We have various formal and informal levels of feedback that tells us whether or not we're actually delivering a good service. You know, the formal level, we get inspected by a variety of different bodies. Nationally, we have people like the Mental Health Act Commission, we have the Healthcare Commission. Locally, we have scrutiny committees with local authorities. These are all formal bodies that actually check that we are actually delivering a service of an acceptable standard, and that if there are issues to be picked up, they will pick them up. We also locally have various user groups and carer groups who come in, they monitor our services, and they feed back to us through a variety of forums about whether we're actually doing the job that we say that we should do. I think one of the problems in healthcare has been what we've been measured against, how we describe our services. And again, we're back to this thing about, there will be national targets around outputs and one or two around outcomes. But to your user monitoring group, is that actually what tickles them? To a user monitoring group, it's things like, were you welcomed in a warm way? Was the signposting good? Did the nurse see you on your arrival on the ward? Were you told when and where you'd see your doctor? I once had a meeting with a user who gave me a fascinating insight into. She was a very articulate, intelligent lady. She was admitted to an inpatient acute ward with quite a severe depression. She arrived late at night, a busy inner city acute ward. Arrived late at night, anxious, scared, very depressed. The nurses were busy. They showed her to a bedroom, and then they didn't see her again until the following morning. And she told me the one thing that struck her about her admission in that ward was that nobody told her where the toilets were, and she was scared to ask. And when you feed that back to services, that's the sort of thing we should be measuring, isn't it? It's just customer satisfaction. It's about actually when I walk into your unit, I expect to be treated like, a very important person, given the constraints, the resources you've got. You go to the independent sector. You walk in to an outpatient appointment, you get a cup of coffee. You're told if your consultant's going to be late. You're given feedback all the time. It's a nice environment. Those are the things that sometimes get missed in the more formal measurements of our services, if you like. We need to start thinking of ourselves as a public sector organisation in a private sector environment. The private sector are very good at customer care, customer focus. They're very good at this whole issue about the welcoming aspect, the atmosphere, the culture of the buildings, the response of the staff. I think the public services historically, have not had that focus. In the NHS, as we move much more towards business styles of service delivery and business styles of how we manage our services, we've got to take that on board. We can't just manage our services in terms of numbers, money, staff. We've got to measure it in terms of this sort of soft, qualitative part of the business. So if somebody comes into our service as an employee, they need to understand that there's a big issue about customer care. People come into our services when they're in distress. People don't walk off the street into our services, generally speaking, if they're wonderfully physically and mentally fit. They come in various states of distress. We need to show a lot of empathy, a lot of sympathy, but also we need to guide these people through our system. And that's sometimes, I think, quite a difficult situation for staff who've not been used to that cultural way of working. And of course, in doing that and linking that into how we're monitored, both formally and informally, we need to use their measurements to feed it back to staff so that we can improve the way that they treat these people in terms of, say, the sort of the customer care bit, if you like. There's a level of sophistication that we haven't got in the healthcare about feeding back information, measurements, these metrics, in a way that changes the way that we deliver our services, so that we actually do deal with people in a very focused way, a very polite way, and we do show customer care. And one of the things that we're trying to do with our staff is to get them to understand why people come into our services, when they come into our services, and use the measurements that we get so that we've got the right resource in the right place at the right time. That's the first part of it. Once we've got the right resource in the right place at the right time with the right skill, It's then about building the quality bit into that so that our service users are met with dignity, we are polite to them, we have exceptional levels, as I say, of customer care. What our staff need to be able to do is to have some sort of mechanism whereby if we fall short of those standards, we can actually do something about it. Now, of course, we can't do a Tesco's and give them, vouchers or whatever, but we can offer a bit of humility, I think, and actually accept that, we've fallen short, talk to people, explain to people, and feed it back into the system. And that, of course, is the key bit about information and about metrics. It's about using that information in a way that improves our service and feed it back so that if it's a training issue for staff, we deal with it. If it's a resource issue, we deal with it. If it's an issue about location, we deal with it. We're sat here in a fairly rural part of West Yorkshire. We cover a large part of the Dales here. There's issues about location, about distressed people travelling a long way to our services. We've got to balance out the use of our resources with where our customers are, in a way that doesn't make us inefficient, but does deal with people's transport issues and their quality of life issues. And the only way we can do that is by getting feedback and turning that feedback into some sort of a measurement and then adjusting and developing our services accordingly. If you go back to the principles of the NHS, it was about improving the health of the nation. Now, over the years, the public's expectations of the health service have grown immeasurably, in part because of the efficiency of technologies. We've become much better at treating things. We keep people alive longer. Much more people have access to treatments that they wouldn't have had many, many years ago. And so there's now, I think, a change in that years ago people would be, I think, grateful for having some treatment. Now they expect and demand treatment. And we're at a point where those demands, I think, are outwith our ability to meet those demands, i.e. supply technologies to meet them. So what we've got to do is make some sort of balance and value judgments about which bits we are going to be delivering and which bits we might think, well, actually, there's a resource issue here. And that's a very tricky thing to do. And I think the government, in their development of the National Institute for Clinical Excellence, have gone a long way in actually in identifying a body that can help make some of those decisions. But of course, the volume of work that needs doing is massive. It's interesting that the model, the NICE model, has actually been used internationally, and it's recognised as a very good model about measuring the cost effectiveness of interventions. I think as people have got more demanding of healthcare services, I think what politically we have to do is almost go back to the consumers of our services, the public, and say, well, we've got a responsibility to meet your healthcare needs, but you've got a responsibility to look after yourself, and to look after your families, look after your children, and promote healthy lifestyles. And I think that's the bit where we're now at, and it's quite a difficult bit because there's a difference between being a nanny state and encouraging healthy living, but we cannot carry on in the way that we're doing in trying to meet everybody's needs. We're already seeing high-profile cases where, some patient groups are being denied access to medication, and that's getting through to appeals and judicial reviews. And we're going to get more and more of that, I think, as people demand healthcare. Now, we can sit here now and make, I guess, a very objective judgment about what we think is acceptable to deliver and what isn't. But if we had a certain illness, or if our family had a certain illness, then our views would become much more subjective, and we would lose the ability to take, I guess, a global view of it. So that's a real tricky position, and it's a politically difficult one. It's a very difficult one.